Hi guys, this is Stuti and we are back after a bit of a break. We're sorry about that, but we promise our guest more than makes up for it. I would like you to meet Dr. Riddhi and she will just give us a little bit about herself, and trust me, you want to be here for this chat. So meet Dr. Riddhi.
Hi everybody, my name is Dr. Riddhi Jain. I am a cosmetologist, not a dermatologist. I'm a practicing dentist from 14 years. I love skin, I love dental, I'm passionate about it. So basically I deal with anti-aging. That's what I'm here for today.
So to begin with, my first question is that dentistry is something that you've done for over a period of years, but of course you made this change into being a cosmetologist. So what is the difference exactly? Because we see that dermats are flooding our Instagram feeds, but we don't know that much about cosmetology. So if you could just touch upon that.
So cosmetology is different than dermat is that we don't treat diseases. We just make you all keep looking beautiful and glamorous and just the way you all look 20 when you guys are at 40. It's basically a natural aging process. We're not into treating diseases like psoriasis or XYZ to take it forward.
Okay.
Diving to this cosmetology, I've been traveling globally. I've been studying all around the world and doing a lot of things and just realized that everywhere outside, dentists are practicing cosmetology. They're a lot into Botox and fillers because we have trained hands. One, we've been doing that from quite many years. Second is that we study a lot of face.
Correct.
So we understand the muscle attachment, the nerve attachment really better.
Yeah.
So that's one of the reasons why we got dived into it. So a lot of my friends practicing in the US, let it be in Korea, and let me for that in Sweden. So people have been practicing, and one of the forces or reasons my friends push me, why aren't you guys doing it? And there I am, and here we are. We have started something which has come its way and it's growing. The baby is growing into a tree.
I think that now we are flooded with so much information. I would say it's even over information that we don't know where to look when it comes to treatments like, let's say, Botox, fillers, even just non-invasive therapies, because people literally, like I said, on our feeds are talking continuously about what we should get, what brides should get, what you should get after wedding, whatever. It's just continuous. There's so much like conversation about like detanning or even topics that I thought were
There's a lot in the list,
Yeah.
to be honest. But one topic that I really want to cover here is Botox.
Yes.
People have this mindset about Botox, saying that Botox can freeze, can give you like
Correct.
as if you're just plastic. So guys, let me tell you, it's a beautiful toxin that relaxes your muscle. It doesn't do anything else. It just simply relaxes the hyperactivity of your muscle.
Correct.
Of course, it all depends upon the dosage that you play with. Like for somebody who's 20 to 25 will not play with a lot of dosage. But somebody who's crossed 40, 45, we go a little high on the dosage, the amount of units we are depositing on the muscle.
Okay.
Second is, as we are aging, we always like those little wrinkles that look natural.
Yeah.
So when you cross from 40 to 60, we like to keep those little wrinkles on your face that you don't look plastic. It looks really natural.
Correct.
And so your entire body depends upon your esthetician, your doctor, who's really playing the role, and whether the hands are trained, safe, and how much they're depositing. So we always believe that go to doctors who understand you, your skin type, your muscle, and will take it in the right way forward.
What would you say about, I feel like there is also a misconception, and correct me if I'm wrong, about Botox and fillers, because people feel like, oh, she has such a Botox face, when it's actually people who are putting too much fillers. And then fillers move like eventually.
So what happens is Botox is only used to relax the muscle. The filler itself says fill it up.
Yeah.
So wherever there is bone deficiency, especially with your high cheekbones or your temple regions, or maybe a little crowd
under
eye. So basically a bone structure where there's deficiency or there's deficient, there we start adding fillers.
Okay.
Botox does no work of fillers. It only and only relaxes your muscles and gives you like a fresher, a cleaner, a brighter face. So there's quite a lot of difference. Fillers don't move. There are types of fillers.
Okay.
What kind of filler you're using? Whether you want the filler just to volume up, we use lip fillers. We just add in a little volume. People are
correct. So I know my friends who, for their weddings, there are a bunch of them have gotten like lip fillers and stuff like that, and then they just dissolve, and then nothing comes.
So fillers, as I said, there are types. So one just adds volume.
Okay.
A lot of people have deficient chin.
Correct.
So we have fillers that mimic the action of a bone. So they become really hard as if there is bone. So
Okay.
naturally your jawline gets contoured.
Oh,
So fillers
that's
and
amazing.
Botox in combination gives fantastic results. Along with that, we do something called as thread lift.
Okay.
People who have saggy skin or there's jaw dropping, or maybe our mamas, if you see,
Correct.
they'll have a lot of under eye, or they have pre-jowls, or they'll see like they have double chin, or
Is
some
that what
lumps.
people call a facelift?
So non-surgical facelift
Okay.
is this combination of threes that we do.
Okay, okay.
And the results are there for good 1.5 year. Of course, Botox, the frequency increases.
Hmm.
4 months is to 6 months is max. So if patients are okay, we tell them that twice a year minimum we expect them to come
Okay.
to maintain their result.
So my next question is about another hot topic, which is microneedling. And I recently saw a serum actually that even you put the serum and it works as a microneedle.
Really, I don't
Yeah.
know about which is
I
the
sent you the
serum.
link. I just saw it. It's also a Korean product, I think. But generally, I guess microneedling, collagen, all these things are again topics that we know a lot about, and I would just go online and buy like a marine collagen and start drinking it, you know, without even knowing. And I don't go to a dermat super regularly. I just try to get all my information from all sorts of sources. Yeah.
Yeah.
So, what is your take on it?
So I definitely vouch for microneedling one. From age 20 onwards, we drop collagen by 1%.
Correct.
So from age 20 to 40, 20% of your collagen we have dropped. And then we realize, oh, there's a drop, there's a pooling, I'm looking old, there are fine lines, wrinkles, everything starts in. So when we say collagen, when we say microneedling, 4 sessions of microneedling, we boost up to 400% of collagen.
That's amazing.
So when people
That
say that I'm taking this, I'm taking that, of course, that is as maintenance because
Correct.
collagen just not works on your skin. It works on your ligaments, it works on your bones. It's very
Okay.
of an entire body.
Okay.
Our body is made of collagen. Our ligaments are made of collagen, so they all work together. Microneedling for face, it definitely works for face.
Okay.
It will take care of your scars, of your pigmentation, of your open pores, as
Cool.
well on the dust or the acne burst. So I highly vouch microneedling.
Okay.
Again, microneedling depends upon your skin type. So we have a lot of brides. They want to do glutathione microneedling.
Yeah.
These days, Korean
That was the other thing I was going to ask you about.
these days, we're using a lot of Korean exosomes. So there is a particular exosome of Korean that I use in our clinic,
Okay.
and that's my monopoly because that's the only thing I have that the entire Indian cosmetologist will not have. It's
Okay.
a particular company,
Okay.
a lot of Korean exosomes. But that particular brand is only with me.
Okay.
So Korean exosomes have come. So we do PRP where you take your blood, you withdraw, and then microneedling. So there are loads of serums depending on what you want. Whether
Okay.
you have under eye concerns, whether you want the brides want to go flawless,
Yeah.
or whether you want this Indians we love
Everyone
light
wants to go flawless.
complexion, we love to look radiant, and we want like I get this question constantly. Why did you drop your complexion shade? You know, why are you dusky? Like why did
Really?
you? Yeah. So my patients ask me, "आप क्यों नहीं ये कराते हो?" I said, I love my complexion.
Yeah.
I just when I travel, people die to have a complexion. So why do
Yeah.
I go about? But yes, it is a fact that we all want to look white. So there are many serums with microneedling that help you to achieve what you want.
Correct, but people do. I mean, the whole obviously skin lightening is a very like taboo topic almost.
Let's not get into
yeah.
that.
And I understand. I think that people mainly the pressure comes when people are getting married and stuff like that. They really do
They
feel
want to.
like this happens. But then, so I know that glutathione is there's a side effect that is skin lightening that people use.
Exactly. So glutathione is an antioxidant.
Correct,
It
yeah.
basically, you and me, we have different complexion. So you have a melanin. You also have melanin, which is
Yeah.
the fairer one.
Correct.
I have a melanin, which is the darker one.
Okay.
So there's an enzyme. I don't want to put jargons, but there's an enzyme
Huh.
that converts the light and fair. So
Oh.
glutathione acts on that enzyme and allows it to convert into the lighter complexion melanin.
Okay.
So that's the side effect. So glutathione is a powerful antioxidant. It
Okay.
really helps in cleansing your system.
So when people are talking about it so much to this extent, they're talking about it mainly for its antioxidant properties.
No, they want to just get light. They want to drop their complexion, and that's why even IVs are coming these days. There's glutathione on IV, and there is everywhere in the market. To a point, we are giving home services also. So
Oh.
brides can't make it. Okay, fine. Their wedding Then detox IVs,
Yeah.
where people want to just have a hangover one day, party in the wedding event.
Yeah,
and
that's what I
the
thought
body's
it's used for mainly.
So no, there are a set of IVs that we use. So glutathione is one of them.
Okay.
As we were talking about the microneedling, there's collagen also that comes in picture.
Correct.
But there are oral supplements also, and there is IV to it also.
And what about collagen that is applied? Because I've always been confused about this. There's right now that super viral collagen mask, that's like kind of thick and it comes in two
Yeah,
parts.
so there were two types of collagen. I don't know if you remember. They used to apply the sheets, spray. But I have it in the clinic and actually show it. I don't see the result.
Because it says that the collagen cannot be absorbed by.
How can it be? That's the reason we're doing microneedling.
Yeah.
We're putting it in the body through
Correct.
IV or taking it orally as
So
well.
you think that is a fad and we should not all
That
just
is,
go
you
to.
can just enjoy getting the little shine. Oh, I did something for myself.
Yeah, it's
just
a
feel good
self-care.
factor.
Yeah. So quickly while we're on this topic, I do want to address the difference between like vegetarian collagen and marine collagen because actually even when I bought my supplement, I did some research and it said that marine collagen is the only real one and stuff like that, and it doesn't even like it tastes so bad, but like I still drink it. So since we have you here, what is your opinion on it?
So of course, marine collagen is far superior and better because the absorption is great.
Okay.
But we do have a lot of vegan clients who are not very okay about it. So
Sure.
we do vegetarian collagen.
Okay.
People believe that veg collagen gives no result, but trust me, I have done my study.
Okay.
To the point I have given collagen to my mom-in-law. Believe to your mom-in-law, you can't really mess about that. And in the span of 3 months, we realized that her crow's feet started settling.
Oh, that's amazing.
To a point we didn't realize that she had some pain in her joints, but that also started settling.
Okay.
Of course, if we have to compare, I will also vouch marine collagen.
Okay.
But since my name has a Jane in it, and I do believe that we can't go that way even as a medicine.
Yeah.
So definitely there are veg collagens.
Alternatives.
Which are alternative. If marine collagen gives you results, say in a span of a month or 2 months, veg collagen can take 6 months. But it is definitely giving us results for sure. It's doing its job for me right now.
I think this will make a lot of people feel better.
Yeah.
And even like taste wise, I feel like it's like almost a mental block.
I will give you that. I will give you a drink to have of the veg collagen.
Yeah.
Because we get flavors.
Yeah.
So there's a blueberry flavor, there's a strawberry flavor, there's an orange
mine
flavor.
is flavorless and then I have to add it into something and then it alters the flavor of that. Yeah, it's really a little bit of.
But I really like the fact that collagen is at least people are understanding that we need to take collagen one.
Yeah.
And there are multiple sources to it. Like I really and highly vouch IV collagen.
Okay.
It really does. It's like once a week you take for 10 weeks straight, 12 weeks straight. And then you're on supplements. So that initial boosting of collagen directly through the blood really does work. Because instead of drinking, the absorption rate is slower as compared to the IV, which is directly in the bloodstream. There's no breakdown of collagen, it's direct absorption. So it really does its work.
Nice. So if you had to endorse one, I know of course it must be so subjective for each patient, but for someone who is probably let's say early to mid 30s or even mid 30s we can talk about, what would you say, because there are so many, there's like a range of treatments, right, and now we are again bombarded by all of them, so how would you recommend that people break up the invasive versus non-invasive, and what would you say?
So there's about the mindset.
Okay.
Like for example, you're maybe among us also, Yukta. She may not be okay with microneedling. But if I tell her, okay, let's do a HIFU, where we're non-invasive, where we put the energy and we lift your skin,
Okay.
she'll be ready for it.
Yeah.
So it's about your mindset, what you're ready for. But for some reason, I just love microneedling.
Okay.
That too, microneedling has to be done by a doctor.
Okay.
It cannot be done by a staff or it cannot be done by somebody in the salon.
Correct.
It has to be done with proper guidance, proper measurements. But I love microneedling. I see the results. And the results are fantastic.
That's amazing.
I love it.
Definitely. I've been on the edge about microneedling because it looks kind of scary.
It looks the
Yeah.
same because there's something called as vampire facial.
Yeah.
Surgical
That got
blood
copyright.
mask.
Yeah.
But there's a lot more to it. It's just as one of those stats because it's got very famous. You see one of the celebs posting it.
Of course.
And
Why not click on it?
And it's there. But yeah, microneedling has a lot more to it. But that's one treatment that I really love. Love to another. If we can start microneedling early, there can be a chance that you can delay the Botox and fillers also. So when you say mid-20s or late 20s or early 30s, that's one treatment I tell you that you all can start. But again, I like baby talks or Barbie talks because
Yes.
fine lines is really taken care. You don't look plastic because then you're diluting the Botox.
Yes,
To
so
another
we
level.
naturally come to this topic, which is
The Barbie.
definitely one of my favorites. And when I read it, I was like, just the name is so cute. But yes, tell us more. What is it? What age do you recommend it? What does it really do?
Botox or Barbitox, as the name says, you dilute the Botox.
Okay.
So if you get, if normal Botox we dilute, say by 2.5 or 2.7 ml,
Okay.
you always dilute it to the double amount, like 5 ml. For the same 1 ml Botox,
Okay.
you dilute it like 2 times more.
Okay, that's actually really good
And-
clarification.
yeah.
I just thought it's like little Botox.
I know. We dilute the Botox and then we add droplets on all over the face because we are diluting it to a great
Okay.
level. So there's no reason for your face to become plastic one.
Correct.
We are not directly getting into the muscle attachment there. We're working on the layers of your skin.
Okay.
So there's fine creases and lines, and we will realize with the kind of lifestyle we are staying at 20 onwards, only we start seeing the difference in the skin.
Okay.
So we say 20 to 25 is good time. We can just basic start this maybe like once in 6 months, once a year. It's completely your core. Exactly.
So it's almost like skin maintenance.
It's just that as if you're going to do a metafacial,
Yeah.
you just do like a Barbie talks, just get a good cleanup, get the Barbie talks, and you're ready to head.
What do you have to say about like the mindset of people? Because I feel like that, and you see a change is more important because even when you said first 2025 to me, I was like, oh, that sounds like it's like super young.
early.
Considering like I am myself like 33 now. So, but again, like I told you, like I've told whatever my mom or Massey or whoever that like please look into these treatments and don't keep applying like serums. Please go to a dermat and like see what you can do, whether it's fillers or whatever you need to do to feel good, look better, and just do your maintenance via a doctor rather than sitting and doing all the skincare at home. Yeah. So, what do you think about the mindset? Because why does it feel in India still like Botox and stuff like that is just something that like only celebrities do?
So what will happen? To speak honestly, our daughters
Yeah.
will be at a better place to understand this because we are ready to accept it.
Correct.
Our mama's generation and Nani's generation, for them it was more of natural. Uttan lagao, ye lagao, ye lagao. That time the food was different, the lifestyle was different, the stress levels were different. They had different things that they were combating.
Yeah.
So mindset definitely comes into picture. They said, "Itne saal nahi kare to abhi kyun kar rahe ho?" The awareness is increasing now. So I think the next generation, I have children and I have girls who are 16 and who are coming for laser.
Yeah.
So that's the way. At 16, I think my parents didn't allow us to do even waxing. They were like, "Ye kya kar rahe ho?"
Yeah.
So now the parents are aware. And that's the way the awareness is increasing. Of course, it takes a little time because everything comes with money.
Correct.
And the mindset to spend on yourself is a little challenging here.
Yeah.
That's why the term is celebrities.
Yeah. I also feel like people feel like that rather than spending like a lump sum, but they're spending like probably lakhs on skincare over whatever, I guess now the way we buy skincare it won't even be over such a long period of time. But like it's so beneficial to even have a parent or have a guardian or an older sister or whoever who says that okay, but this is not necessarily a bad thing. Like make this investment or whatever, 50,000, 75,000.
So to speak honestly, like we buy jewelry for the local to enjoy it.
Yeah.
Honestly. And our faces are jewelry.
Yeah.
We will not even want to take care or spend few thousands on it. Honestly.
Yeah.
Second is we'll go to a restaurant, we'll pay somebody else's bill.
Yeah.
But here for a basic meditation, we tell you to pay 4.5, itna sara.
Yeah.
So it's about, again, where and how much you want to invest, whether you really want. And for me, I think I would rather invest in my skin and take me a longer way, let my face can be the jewelry and I don't have to highlight myself with a lot of
of course. And it comes with so much. I mean, like I have fancy pants also. We completely believe in this that if you dress well, you step out well, you feel so confident.
Yeah.
And
totally.
you feel that with skin is the biggest.
I think it's the largest organ of your body.
Yeah.
Honestly.
And if you step out with like whatever clear skin or if you glow, like people like or makeup almost like can't make up for that. Or
what a natural shine of your skin can create, nothing can do. So when we talk about glass skin, the glass skin means is that when you stand in light or under the sun, and when
The
your
light
skin
reflects.
radiates,
Yeah.
that is glass. You
Yeah.
always can't go like glass everywhere.
Yeah.
So glass skin for me is when, and that's what I try to give all my patients. Like when you stand under the light and your light skin reflects it, that's the real glass skin.
So I guess my final question is about something quite exciting. With everything that is happening in the skincare world, where do you see it going, and what is something that is exciting about it to you right now?
So honestly, skincare is coming a long way.
Good.
People are getting aware. Of course, it's going a little slow, but they are getting aware. They know what is happening. And I think in the next 10, 15 years down the line, skincare world, cosmetology is going to be another boom, another league. With a lot of new technologies and equipments coming in India,
Okay.
let it be your hair, your skin, your teeth, India is really progressing its way forward. And of course, options are going to open up. A lot of Korean, Japanese things are going to be coming up.
Yeah.
And we're going to see a range of fillers that are coming in the market. And IVs are doing its work. So the new thing that I think I'm going to see over the next 15 years is that I'm not going to have a crowd of 30 to 40, but I'm going to have 17, 18-year-olds sitting here outside. The doc, we want to do this and we want to do that.
So if you're 17, 18 or in your beginning 20s, you should. This is actually really. This is the first time I've heard anyone, talk about it, and it's just so good because I feel like it opens up people's minds to what is really happening in the world versus what we just think is happening and we just like go along with
But
it.
I really want to say one to us, our generation, new generation, everything is not got to do with your social media. Please meet your doctor, let it be your dermat, esthetician, understand your skin type, and then buy products. We just go buy, and we spend so much there that when the time comes to do a treatment, the mother's like already spent na kharcha kiya.
Yeah.
And they're just lying on the rack.
Yeah, that's
so
true.
please understand what your skin needs and then take it forward from there. So I always believe anti-aging has got to do with your face, your structure, your supplements, your routine, your care, even your dental for that matter. That after 30-35 you realize कि दांतों में खाना अटक रहा है. It's a sign to understand there's a bone loss happening, and then we recommend you to wear night guards or retainers at night and sleep so your health is maintained. Usually you realize the face is beautiful. As soon as she smiles, drop, the age is revealed. So it's a combination treatment that we always say that goes together. So the only little advice I will say is understand your skin type, meet your doctor in concern, then take it forward. Have an open mindset. The moms, the dads, it's just not for women.
Correct.
It's even for men today. Understand your skin type, understand your concerns, and be very open about it.
Yeah, and I feel like people
Accept it.
Yeah, people shouldn't be like that. Oh, I'm doing this because I'm like vain. It's almost just like how you're maintaining your body, you're also maintaining your skin.
Your hair, your nails, and also there should be a very openness. Ki it's about, oh, don't tell this one, oh, don't tell that one. Maybe you just confronting somebody will give that person a mindset to do about it.
Yeah.
कि अरे मैं भी try कर सकती हूँ.
I feel like
You
one
gotta
person in
feel
our
it.
friends group does something
And then you're
people
ready to
automatically
try.
like, yeah, but she looks
I
good.
agree.
Great, thank you so much.
Pleasure's
This
all mine.
was really fun and
I hope
really
it was
insightful.
informative.
Very
What you guys are
insightful.
looking
I
for.
think it's going to be quite a revelation for everyone watching. Of course, we'll tag Dr. Riddhi. So please feel free to reach out to her. And we will leave your details also.
Definitely.
So I'm sure you're going to be swarmed with some DMs.
More than happy to help them. So as doctors, we believe that let's all grow together. So in our clinic, we definitely have a dermat on board. We have a plastic surgeon on board. We even have an oral surgeon on board. So everything got to do with your skin, your hair, your teeth is taken care of. But yes, we don't practice dermatology. We do cosmetology, and we do have a dermat to take care of the rest of the things. Thank you.